The challenges for DeKalb County really center around the call volume that we have. We found that it was always tough for us to have enough units on the road to really provide an adequate service.
The 911 system in DeKalb County faces the similar challenges that 911 systems face across the United States. Callers, large volume of callers, trying to keep up with the lower acuity, non-life-threatening callers while maintaining the care to the life-threatening callers.
The population here is very high. There's a high call volume, and a lot of those calls are people who don't have access to health care, don't have a way of getting access to a doctor or a nurse, so they call 911 for calls that typically would go to an urgent care or to a doctor's office.
We don't want to send an ambulance and fire truck to every call. We know that they're not always needed. We know that a percentage of calls, even when we do send those resources, result in a non-transport. The individual decides at that time they don't want to go to the hospital.
Once the caller is determined to be low acuity or non-life threatening, they get transferred to the nurses. The nurses have an actual triage protocol that they also start with the highest level of acuity and work their way down to find the appropriate destination and help the caller with that. So in that case that the caller gets turned over to the nurse has the ability to find an appropriate clinic or primary care for that person to go to. Or the callers may result in just needing nurse advice only and not needing medical care.
Since the Nurse Navigation program began, I have seen the call volumes drop. There are a lot more high acuity calls that I'm responding to. We're not responding to any of the lower acuity complaints, like I said, flu-like symptoms.
Again, at the end of the day, I think, DeKalb County has done a wonderful job in trying to bring new technologies into their community and manage their call volume appropriately. First of all, implementing Nurse Navigation was probably the first step, moving calls to other buckets that they can handle appropriately. At the end of the day, their system's going to run a lot more efficiently.
The callers are first maybe a little surprised that there's another avenue for them to explore other than having the ambulance or someone come to their house.
20% of the calls from 911 that come to the nurses result in nurse advice only, where the caller feels that all of their needs were taken care of in talking to the nurse and they didn't need to be transported or medically evaluated. The feedback has just been overwhelming from the patients.